The reopening was early. It was somewhat controversial. Then it was, I think, lauded and sort of pointed to as a way to do things where it might not there might not be any recriminations about it, shall we say. Are we still there? We're always going to offset economic costs and health concerns, I guess, to some extent, Senator. Would you say it's going well in your state?
It's going very well, Joe. Good morning. We're following the president's three-phase plan to reopen the economy. We're doing it judiciously. Active cases are not rising in Georgia. We've had no real spikes in deaths or infections. We're following a similar curve to other countries that are ahead of us in this virus. But we're being very careful. We're following the protocols. I was on a plane yesterday from Georgia to Washington, and most of the plane was full, but they gave us a choice to get off the plane or to not take that flight. Everybody uses masks. So we're following the protocols that have been proven to work in our essential workers and our military, Joe, that have had, those two communities have had less infection, basically, than the rest of us. So we know what to do, and I think we're doing it judiciously in Georgia right now.
When you see what's happening in some other parts of the country that we've been reporting on, can they learn from Georgia? Are you concerned about what's happening in Texas or Arizona, Senator?
Well, it's all relative. I mean, if you look at the deaths per 100,000, I mean, we're way down compared to New Jersey and New York. So we've learned from the states that have had big spikes in both the death rate and the infection rate. So, yes, I mean, what we're doing in Georgia, and most people are adhering to this. I've been out in restaurants. I've been flying, obviously, since the Senate is back in session. So I've got a pretty good perspective of how things are happening in Georgia. And right now, people are adhering to the protocol. We've reached out to, Joe, almost 1 million people through these constituent conference calls at night. It's been very enlightening in terms of people taking care of each other, adhering to the protocols, and paying attention to what the public health officials are telling them.
What are we doing for stimulus, would you think? Half of it's the $2.9 trillion has been spent. I think we've had you on before, and I don't want to put words in your mouth, but I think your feeling was that enough has been earmarked already. But we are talking about additional stimulus, maybe infrastructure. What are your thoughts on what we need to do, since you do care about business and getting business back to work as well? What more do we need?
Well, business is coming. I mean, there's a lot of demand out there right now. I'm worried about our supply chains. There's going to be a bumpy couple of months, in my opinion. The jobs report 2 weeks ago was encouraging, but we've got $2.9 trillion we've already appropriated, but only half of that, guys, is out working. The PPP program got out very early, and the average loan of the PPP program, guys, is $116,000. So these were the smallest businesses in America that are getting this relief. I call it relief, not really a stimulus. The next phase of this thing could be a bump up if we need it in PPP. We just saw yesterday the Treasury is talking about now the Main Street program is just getting started. So I'd like to see the impact of this investment we've already decided to make before we decide to do something else. I applaud the president for wanting to do more in infrastructure. God knows we need it. But right now, we've got to get the economy going first, get people back to work, and get this economy moving again.
Becky.
Senator, just in terms of getting people back to work, we have heard from businesses in some places who have not been able to get their employees to come back because they're making more on unemployment, also because they have all kinds of other issues like child care. Maybe they have to stay home, or they have underlying conditions, so they can't come back between coronavirus. There has been a lot of talk of how we motivate people to get back to work who can go back to work, but also make sure that you continue to provide protections for people who can't. How would you see coming down on that? And is there any sort of stimulus that you could support that would work towards those goals?
Well, if we can reprogram some money, which I think we can incent people to go back to work. Look, we fought this premium on unemployment in the very beginning. I actually put an amendment on the floor that would have undone that. But what we saw is that was a negotiating item that we had to give in on in order to get the PPP program, and so it was a price to pay. My concern right now is just what you said, Becky. It's a great observation that small businesses are having trouble getting people to come back to work, particularly at the lower level of income. They're getting a premium right now in unemployment. We knew that when the bill was passed. We tried to do something about it. So right now, there is a possibility that we could reprogram some money to allow an incentive for people to come back to work. We've just got to outlive this premium period. The thing I'm encouraged about is we've given small businesses another 4 months in order to use this money. And so that will allow them a little broader bridge than maybe what we anticipated.